Hello, my name is Dr. Carol Jenkins Neal, College Professor of Nursing. My main concern with COVID 19 is population health and health disparities. Very important topics. Population health could take on several populations: the mental health community, the senior community, the vulnerable population. In Jacksonville, we have an area, Health Zone 1. I'm very concerned about Health Zone 1. This is an area that is considered as a vulnerable community or population. The population, a lot of people don't think about the unborn children and babies that are born with COVID 19 and how that is impacting the family. With COVID 19, some of the things that are serious right now that we need to consider across the board, not just in Jacksonville, are those individuals with lack of access to care, lack of insurance, and lack of finances. Those three factors alone is major when it comes to COVID 19 or any other chronic condition. As healthcare professionals, we need to acknowledge that health disparities is here, and we need to take a stand so that we can make an impact in our community. Thank you.
Hello, my name is Dr. Barry Wright, and I serve as an inpatient internist in Jacksonville, Florida. By the nature of my position, I have had the opportunity to serve on the forefront of this pandemic, admitting patients that have been ill enough to require a stay in the hospital, and also taking care of them throughout their hospital stay. I've sat at the bedside of so many patients, and I've discerned that there is a level of despair that goes beyond the viral illness itself. So many of them have not even had the chance to say goodbye to their loved ones, as they passed away in hospitals full of strangers, even if compassionate strangers. So we, as a medical community, recognize that there are limitations to our reach, despite the most noble intentions. As president of the Northeast Florida Medical Society, an entity designated to promote excellence in clinical practice, and also to help meet the needs of communities most disadvantaged by limitations in resources, we help to derive a plan, collaborating with local institutions, collaborating with the city, and collaborating with the state to help bring mobile testing into these communities with the most limited access to healthcare resources, education, and treatment, as we've seen that these communities have been disproportionately impacted by the pandemic, as they have been with other healthcare maladies. So our team also recognizes the limitations of curative medical interventions, but we also know that our nation serves a God that is beyond those limitations. So we organized a prayer vigil for doctors across the world to pray daily, both on and off the hospital campus, to spread a message of faith over fear, of hope over despair, and it's already made a difference in the atmosphere of our medical institutions and even in the city, to unite us in love over isolation. So I'd like to thank everyone, whether in the medical industry or in other arenas, for your efforts, the heroic efforts you've made to help bring us through this challenge. Thank you.
5.
I'm Sylvia Walker, a registered nurse. I live in Jacksonville, Florida, and I am a member of the First Coast Black Nurses Association. My community has been impacted by the coronavirus like many other cities across the state of Florida. In Jacksonville, Florida, I have observed and witnessed limited access to COVID-19 testing and resources of PPE being readily available. The homeless population has not been discussed enough. You have the young adults who have aged out of the foster care system. You have families with school-aged children, and then there's the veterans. Homeless individuals of today do not look like the homeless individual we may have encountered in the past. They access the same places everyone else does: the library, the grocery store, and retail shops. If we don't include them, the number of infected will continue to increase. Thank you for allowing me to share this information, and stay safe.
Good afternoon. My name is Dr. Jenisha Moore. I'm a nurse anesthetist here in Jacksonville, Florida, and I am a part of the First Coast Black Nurses Association. And I'm just here to tell you a little bit about how COVID-19, aka coronavirus, has affected us and our job. Here in Jacksonville, Florida, once everything started to be noticed about the coronavirus and as far as how it's contacted and contracted between an individual person, it has changed us as a hospital and as far as the ORs as a whole. So one, for the hospital, everybody is mandated to wear a mask throughout the hospital. If someone sees you without a mask, either you place a mask, they give you a mask to put on, or they can report you. As far as surgeries, we only do emergency surgeries and surgeries that deal with like cancer and things of that nature. Those are the only cases that are going. So that has dropped us down to a good 10% of cases being done. And as far as whenever we talk to patients, usually we can talk just like I'm talking with no mask on to you guys via the video. However, now we have to place a mask on once we talk to a patient. Usually the patients come in with their own mask. When we take them to the back to go intubate, we have to place an N95 mask and a regular mask on top of our N95, also with some glasses, so we won't have any exposed areas when we intubate. And as far as the CRNA job, we're very close and personal with the patients, especially with the airway. So at any time one patient coughs, they can have any droplets come out. And this is before we can even identify if they're positive or negative with COVID. Also, it has changed our sequence as far as intubation. Usually we can give a non-depolarizing paralytic and breathe our patient down in order to intubate, but now everything has to be rapid intubation. So as soon as we give the drugs, we're placing the intubation tube in the tracheal tube in, so it can, so people in the room are not exposed to COVID virus if that patient does have it. Also, because of the drop in hours, that affects everyone, not just us, but the nurses and doctors also in the OR, that we have become part of what we call the intubation team for the hospital. So we are the subject matter experts on intubating patients very quickly. So with that, we have a team that's advised of a CRNA, an anesthesia assistant, and a nurse. And we are the ones that are on call to go from the ICUs to the ER to even on the floors to intubate patients that are COVID and non-COVID, because we can do that in a rapid way. So that's a little bit how it has affected us on the nurse anesthetist side here in Jacksonville. Thank you.
Good afternoon. I'm Adam Smith. I'm a nurse practitioner practicing within the endocrinology specialty, endocrinology and diabetes management. I'm a Jacksonville, Florida native, and I'm a member of the First Coast Black Nurses Association here in Duval County, Jacksonville, as part of the National Black Nurses Association. Here in Jacksonville, which is Northeast Florida, we have a huge, dense patient population in general. Unfortunately, we have and are experiencing the effects of COVID-19 in our patient population group. In my role as a nurse practitioner, we specifically care for patients both in the hospital setting, the inpatient setting, as well as in the outpatient setting in the clinic or office. For patients specifically in the office, in order to maintain social distancing guidelines, we are making sure that we still provide access to our patients in order to meet their healthcare needs. As many of you know, we have been doing telemedicine, virtual visits in order for us to ensure that patients are still being cared for properly, just on the continuum of care, making sure that they're staying compliant with medication regimens, or to see if they possibly need any adjustments to their medication regimens, seeing if they even have any issues retrieving some of their medications from the pharmacy. So From an outpatient basis, we have definitely been at the forefront in making sure that we're meeting patients' needs. Here in the hospital, we primarily serve as the inpatient diabetes management service. We know through many reports from news outlets, we know that patients who have very complex chronic medical conditions are at higher risk of developing COVID-19, whether these are elderly patients or whether these are patients from just kind of vulnerable socioeconomic backgrounds. We see it day in and day out here in the hospital, where we are being extra aggressive in their diabetes management, definitely for those who are diabetic and have also been diagnosed with COVID-19. Many clinical studies and research has been done to show that the better that patients' glucose is controlled from an inpatient hospital setting, we know that it not only reduces length of stay, promotes improvement of other complex medical conditions, but we know that it also can help to assist or suppress the risk of an underlying infection, be it viral such as COVID-19, from exacerbating. We have been here at the forefront amongst the team of nurses, physicians, respiratory therapists, ancillary staff, rehab therapists, at making sure that we are doing all we can to meet the needs of our patients diagnosed with COVID-19 and who are also battling other chronic, complex medical conditions. One of the main problems that I've noticed since the outbreak of COVID-19 is that a lot of patients, unfortunately, have had to file for unemployment. A lot of patients, unfortunately, might have been furloughed from their employer. Some might have received pay cuts or hours reduced in order for them to work. Because of this, a lot of patients are unfortunately unable to afford some of their insulin. So something that I would like patients to know is, please reach out to your primary care provider, please reach out to your specialist, your endocrinologist, and speak with them in regards to any barriers you might be having during this time so that we can best meet your healthcare needs. A lot of pharmaceutical companies, for example, are in this time of COVID-19 are offering 30 to 90 day supplies of insulin. A lot of pharmaceutical companies are offering just different special patient programs in order to assist them and meet their needs to ensure that they maintain their health. Another thing we also are encouraging our patients to do that we see in the office is just to stay healthy. During this time of quarantine, there's a lot of snacking going on. So please just use this as a time to maintain your health. Please use this as a time to stay compliant with your medication regimen, and just use it as time to go outside, get some physical activity, get some fresh air with you and your family, and we will all get through this together. I encourage every family member, every patient, every provider, please reach out to your patients, please reach out to your fellow loved ones that you know who might be in an at-risk patient population group, and see how we can best assist them and meet their needs, whether it be picking up some of their prescriptions for them from the pharmacy, whether it be going to the grocery store to assist them in getting healthy items so that they can still maintain their health and nutrition, but don't overdo it in the snacking area. We can all get through this together, and we will get through this together as we just continue to have faith over fear. Thank you.
Many a day we did all we could do. Many a way that a light came shining through. Many could say what the world is coming to. The job is never done for the Jacksonville Unsung. There is a light that shines from up above. There is a need to show each other love. Do you know just what we're thinking of? The job is never done for the Jacksonville Unsung. You're not alone in the darkness of the night. You're not alone in the middle of a fight. You're not alone when the dark covers the light. The job is never done for the Jacksonville Unsung. We're always here for you. We're always here for you. We're always here for you. The job is never done for the Jacksonville Unsung. Many a time we felt like we had lost. Many a sign when we had to pay the cost. Many a bind when we felt the boat had tossed. The job is never done for the Jacksonville Unsung. You're not alone in the darkness of the night. You're not alone in the middle of the fight. You're not alone when the dark covers the light. The job is never done for the Jacksonville Unsung. We're always here for you.
To all the doctors, nurses, firemen, and police, as well as all the medical professionals of Jacksonville, Florida, as you battle the front line of this COVID-19 pandemic, you have risen to the occasion for putting yourself in harm's way to saving lives of the citizens of Jacksonville. The Mike Mims Foundation would like to express our appreciation to thank you for your courage, sacrifice, and commitment you make every day to dedicate saving lives of the citizens of Jacksonville. We thank you and honor you as our unsung heroes of Jacksonville, Florida. Thanks again for your dedication and commitment to saving lives during this COVID-19 pandemic, and God bless you all.